Many people ask if scaling harms teeth. The answer is no. Professional scaling removes harmful tartar, not healthy tooth structure. If your teeth look farther apart after scaling, the tartar that filled those spaces has simply been removed. People often blame scaling for problems that were already hidden by tartar. Once debris is removed, the true tooth shape becomes noticeable. Scaling does not remove enamel. It removes hardened deposits that brushing cannot remove. Removing tartar reduces gum inflammation and helps prevent gum disease and bone loss. Some people notice temporary sensitivity after scaling. It usually settles. It usually settles as your gums heal. Tartar is hardened plaque. Once it forms, only professional instruments can remove it safely. Most people benefit from scaling every 6 months, although some need it more often. Removing tartar reduces gum inflammation and helps prevent gum disease and bone loss. Avoiding scaling allows tartar and bacteria to build up, increasing the risk of gum disease and tooth loss. Healthy gums start with prevention. Regular checkups and scaling help keep your smile healthy. Follow for more dental tips.